Please note as well that the meeting today is being recorded and will be available following today's meeting. And a handout is also going to be available that summarizes the key content from today's presentation. I want to start off with a land acknowledgement and acknowledge the land that RNAO's home office is situated upon. We recognize that our work and the work of our members takes place on traditional Indigenous territories across Ontario, and we wish to acknowledge that the office of RNAO is located on the traditional and unceded territory of the Huron-Wendat, Haudenosaunee, and the territory of the Mississaugas of the Credit. This territory was the subject of the Dish with One Spoon Wampum Belt Covenant, which was an agreement between the Iroquois Confederacy and the Ojibwe and allied nations to peaceably care and share for the resources around the Great Lakes. We also recognize that many of you today are located on other traditional lands across Ontario. And today this land is still home to many First Nations, Inuit, and Métis people from across Turtle Island. And we're very grateful to be able to work and live on this land. By personally making a land acknowledgement, we are taking part in an act of reconciliation, honoring the land and Indigenous heritage that dates back over 10,000 years. We encourage you to learn about the land you reside on, as well as the treaties that are attached to it. Land acknowledgements are an act of reconciliation, and we must all do our own part. If you'd like to learn more about the land that you are located on, this resource here, nativeland.ca, has some great resources on that. Our team would like to warmly welcome you today. As mentioned earlier, my name is Lindsay Howitt, and I am working closely with my colleague Grishma Jacob, the Guideline Development Lead, on the creation of this next edition Best Practice Guideline. You'll also be hearing today from Christina Madero, Senior Manager of Evaluation and Monitoring. And we are happy to be joined today by Verity Scott, Guideline Development Project Coordinator, and Nassim Nizam, Associate Director of Guideline Development and Research. We are pleased to also have Susan McNeil, our Associate Director of Guideline Implementation and Knowledge Transfer, with us. We'd also like to get a sense of who is joining us for the meeting today. So Verity is going to put up a poll, and it'd be great if you could let us know which setting or sector you work in or represent. We were limited with the number of options we could put in this poll, and we know that this BPG will be relevant for many different settings and sectors. So if one of these categories does not represent where you work or are coming from, please select the other option, and you could also type in the chat box to provide us with more details. All right, how's it looking, Verity? Do we have most of the answers?
We do. So I'll go ahead and close the poll now, and then we can display the answers so everybody can see them.
Okay, thanks, Verity. So it looks like we have people from many different settings here and a number from the other category as well. So it's great to see some more details about that from people that are typed in the chat box. And one thing that we don't have represented here is Ontario Health Teams, which we'll be talking about further in today's presentation too. And we know that many of you are part of those as well. So it's great to have you here. Okay. So the objectives for today's meeting are to describe the purpose and scope of the guideline and to describe the guideline development process at a high level, as well as to highlight key recommendation areas that will be included in the guideline. And most importantly, to share how you can get involved and provide feedback on the draft guideline as a stakeholder reviewer. We'll also be taking time at the end of today's meeting to answer questions about the guideline as well. Please note that the guideline content is confidential and specific details of the recommendations will not be provided during today's meeting. Today's presentation will provide a very high-level overview of the guideline purpose, scope, and content. Today's presentation is the first of a two-part update on the Care Transitions BPG. The second presentation will focus on how the Care Transitions Best Practice Guideline can support integrated care across sectors. So this second presentation will be geared towards OHTs, Ontario Health Teams, and other organizations who are thinking about becoming part of an OHT. So the date for the second presentation is still to be determined, but it will likely occur in the early fall. So stay tuned for more information about this as well. Before we begin, I also want to give some background information on RNAO, the professional organization representing registered nurses, nurse practitioners, and nursing students in Ontario. We are the strong, credible voice that leads the nursing profession to influence and promote healthy public policy and clinical excellence. A signature program at RNAO is our BPG Center, the International Affairs and Best Practice Guidelines Center, which houses the Best Practice Guidelines program. RNAO's best practice guidelines are actively implemented across Canada as well as internationally through partnership with our best practice spotlight organizations, and we're grateful to have many representatives from BPSOs here today, so thank you for joining. The RNAO BPG program was launched in 1999 with funding from the Government of Ontario, and the purpose is to develop, disseminate, and actively support the uptake and sustainability of evidence-based clinical healthy work environment and healthy and system best practice guidelines, and to evaluate their impact on patient, organizational, and health system outcomes. So we currently have 50 best practice guidelines, and this number continues to grow, and a variety of implementation resources as well, which you can see at the bottom of the screen, including the recently released Leading Change Toolkit, which you can find more information about on our website as well. RNAO's Best Practice Guideline program is founded on an integrated model that includes 3 pillars, which you can see on this screen. So the pillar at the top is guideline development. On the left-hand side, we have dissemination, implementation, and sustainability. And on the right-hand side, we have monitoring and evaluation. So at RNAO, when we develop our guidelines, our intention is really to support the uptake of guidelines into practice through supporting dissemination and implementation of them. And we do this through a multi-pronged approach, which includes both individual, organizational, and system-level strategies. And additionally, we also have a very robust approach for evaluation and monitoring to support this, so that organizations can really know the impact of the guideline on persons, providers, organizations, and the health system. So this is the pillar for guideline development, and as you can see, there are a number of steps here. So for the care transitions guideline, for steps 1 and 2 have been completed. The topic has been chosen and an expert panel was convened. And with the input from the expert panel, systematic reviews were designed and conducted, and these systematic reviews informed the basis of the recommendations that will be included in the guideline. And now the guideline has been drafted and it will soon go through external review to enhance the quality of it. And this is where we are going to invite you to become involved, and this is known as the stakeholder review stage. After our guidelines are published, we also try to commit to a 5-year revision cycle. I just want to bring your attention as well to the words grade CERQual and grade at the top of this slide as well, because when we develop our guidelines, we use the grade and grade CERQual methods to support our rigorous guideline development processes. And this is in line with other international guideline standards, and it's used by other large organizations such as the World Health Organization. This critical resource would not be possible without the expertise of our expert panel, and we are grateful that the guideline is being developed in collaboration and partnership with people with lived experience, nurses, members of the interprofessional team who bring their own lived experience of care transitions, as well as their knowledge and experience from clinical practice, research, education, and policy. And the panel is comprised of approximately 20 people from across Ontario and internationally who represent very diverse sectors and settings. And their insights about supporting people during care transitions has been integral to shaping the purpose, scope, and recommendation areas that will be included in this guideline. We'd also like to sincerely thank the co-chairs for the expert panel, as you can see on this screen, Shirley Sharkey and Dr. Rhonda Crocker-Ellicott, who are working closely with RNAO's team to support the development of the guideline. So Dr. Rhonda Crocker-Ellicott is the president and CEO of Thunder Bay Regional Health Sciences Center and the Thunder Bay Regional Health Research Institute. And for more than 30 years, Shirley Sharkey was the president and CEO of SE Health, a national social enterprise bringing excellence and innovation to home care. So we were very delighted that we had the leadership of Shirley and Rhonda. They were supporting us in the development of this guideline, and together they bring a very diverse and extensive expertise and experience from different sectors and settings and geographic regions in Ontario as well. So the expert panel also includes representatives from best practice spotlight organization Ontario Health Teams, also known as BPSO OHTs. And if you are part of an OHT, we welcome you to put up your hand either in person, if your camera is on, or you could put up your hand with the Zoom function as well. We'd love to see who is part of an OHT here. Wonderful. I see a number of hands up right now. That's great. Wonderful. So the launch of Ontario Health Teams in 2019, it really represented a milestone in the journey towards integrated care in Ontario. And OHTs are groups of providers and organizations that are working together to deliver a continuum of coordinated care to a specific geographic region in Ontario. And OHTs are really changing how care is delivered in Ontario. And as such, they are really well positioned to support good seamless care transitions across settings. So RNAO has entered into formal partnerships with 8 OHTs at this time, and the second edition guideline is being developed with co-creation with the BPS OHTs to really ensure that the guideline recommendations support integrated care across sectors. Just also want to share this slide with you as well. This just shows that the BPSO program at RNAO supports these frameworks that incorporate the United Nations Sustainable Development Goals. So this is the circle, the outer circle with all the different colors around it, as well as the quadruple aim, which you can see in the middle of the circle, to support population health, underserviced populations, and promote health equity. And the Sustainable Development Goals, specifically the good health and well-being and reduced inequalities, are especially relevant for this guideline. We know that there are many populations who are particularly vulnerable to adverse outcomes during care transitions, and this guideline is being developed with key considerations being given to health equity. Okay, so now we're going to move on to talking a little bit more about specifics of the Care Transition Second Edition Best Practice Guideline and the purpose and scope. So the purpose is to include evidence-based recommendations for nurses and other members of the interprofessional team, organizations in the health system to support safe and effective transitions in care for pediatric and adult persons together with their support network. And this guideline will focus on transitions between and across settings, including but not limited to acute care, long-term care, primary care, home and community care, rehabilitation, mental health and addiction settings, social care settings such as shelters, and Ontario Health Teams. And this list that's including but not limited to those settings as well and sectors. I just want to point out as well that the term support network mentioned in the purpose statement up there is really used to refer to individuals whom a person identifies as significant in their life. So this may include people who they are related to, or it may be people who they have close bonds with as well. There are a few areas that will be outside of scope for this guideline, and this was determined in consultation with the expert panel. So transitions from pediatric to adult services will be deemed outside of scope, and this topic is quite complex, and there's already quite a bit of literature and guidance that exists on this topic. Healthy mothers and infants transitioning home after birth and infants transitioning from NICU to home will also be outside of scope, just due to the specific nature of these transitions. And given the focus of the guideline on supporting transitions between settings and sectors, micro-level transitions defined as transfer of care or handover between providers at shift change will also be outside of scope. After meeting to finalize the purpose and scope, the expert panel came together and they determined the top 6 recommendation areas the guideline will focus on. So I will briefly speak to this here. Again, we cannot provide, because the guideline is confidential at this time, we are not providing the specific details of the recommendations right today, but I will talk a little bit about these areas and more information will come later on about this. So these areas are support from a system navigator. And system navigator was a term that was defined very broadly to include providers who are working with persons during care transitions to help them overcome challenges navigating the health and social care system. Interprofessional collaboration across settings involves providers from different settings and sectors working together to help ensure seamless care transitions. We have conducting a person-centered assessment to develop a transition plan, review of medication history, interprofessional collaboration within settings. So this is a little bit different. This is providers within the same setting working together, and partnership with persons in their support network before, during, and after care transitions as well. And I'll just point out that the little asterisks in red there indicates new recommendation areas that were not present in the first edition care transitions guideline. I'd also just like to share as well that another area, access to shared electronic health records for providers, was also explored and prioritized by the expert panel, but no recommendation was included on this topic as more research is needed on this. And this is clearly indicated in a section of the guideline that talks about areas for further research. So where are we at in the guideline development process? So as of right now, the guideline is being drafted and it will be soon sent to the expert panel for their review and feedback. And after this, we're going to be preparing for the stakeholder review stage. And this is where we really invite you to get involved. Following this, we will prepare for publication, and we anticipate that the guideline will be published in very early in 2023. So the RNAO team is currently drafting the guideline, and as a next step, we are going to be seeking stakeholder feedback on the guideline from nurses and other members of the interprofessional team, people with lived experience, and knowledgeable educators and administrators throughout Canada, but also internationally as well. So stakeholder review is expected to take place in the fall of 2022. And if you're interested in becoming a stakeholder reviewer, we invite you to sign up online by following this link here. Stakeholder reviewers are asked to contribute about 3 to 4 hours to review the guideline using an online questionnaire and provide written feedback within 2 weeks. And Ontario Health Teams, OHTs, will also have the opportunity to provide written or verbal feedback as a group during the stakeholder review stage, and more details will be provided about this later on. So on the website, this is what it looks like as well. There is a link at the bottom that says click here to get involved, and you can sign up and you can leave your email to get more information about the stakeholder review stage. I'm going to pass it over to Christina now, who's going to share about indicator development and evaluation of this guideline. And then at the end of the presentation, we'll open it up for questions as well. Thank you.
Thanks so much, Lindsay. So as part of our indicator development process, we undergo 6 steps, which not only includes an opportunity for the expert panel to provide feedback, but also stakeholders to provide feedback as well, where you as stakeholders have an opportunity to validate our indicators and provide both quantitative and qualitative feedback. So this is an example of our OSOMI indicator. And so it would look very similar for our care transitions indicators. And so you could grade the relevance, feasibility, usability, and readability from strongly disagree to strongly agree. And also you're provided with an opportunity to provide some comments to maybe provide a bit of context about your feedback and really guide our indicator development process. And so, as you know, we use a Donabedian model for indicator development, where we map the strong recommendations to structure and process indicators, as well as the outcomes of the research questions to outcome indicators. And so, as you know, structure indicators describe the human resources attributes of the setting in which care occurs. And so this may include general human resource structure indicators surrounding, nursing hours per patient day, absenteeism or turnover, or other BPG specific structure indicators that may include continuing education for health professionals, for example. We also have process indicators, which describe what is done to and for persons receiving care in the process of providing care. And this may include assessments such as percentage of persons with pressure injuries that receive comprehensive assessment on initial contact. And then we have our outcome indicators, which really describe or measure the effect of care on the health status of persons receiving care. And this can include the percentage of persons whose stage 2 to 4 pressure injury worsened. And so we'll be looking at all different types of indicators for this guideline: structure, process, and outcome. Structure and process, of course, being dependent upon the strong recommendations, and outcome being dependent upon the outcomes of the research questions. And as we know, it's really important to collect on all 3 to really get that contextual information of best practice guideline implementation. And so here I have a bit of a sample of an evaluation and monitoring chart actually for the vascular access BPG, which is a recently published BPG. And so as part of our indicator development process, we align our indicators to external data repositories to really adhere to a collect once and report multiple times principle. And so we're actually in the midst of continually aligning our indicators in our indicator development process. And so we can actually see that there's also alignment between or linkages between the indicator itself and the recommendation. So for example, for the structure indicator of percentage of health providers who receive practical education on the insertion and or management of vascular access devices, we said it's mapped to recommendation 2.1, and that it's a new indicator in the sense that there wasn't really a lot of alignment with other external data repositories. And so this really allows an understanding of how this aligns with other data repositories and how this really fits within what exists in terms of indicators. And again, this would be, these indicators will be accessible to everybody who has access to the BPG and will be posted online as well once published. And then we have the whole meat and potatoes of why we do this. We really want to make sure that we're looking at a whole story in terms of the progression of BPG implementation over time. So we want to collect on baseline data as well as start of implementation data, as well as post-implementation data to really understand how BPG implementation is affecting persons receiving care, the organization, as well as the healthcare system as a whole. I think I'm going to hand it back to Lindsay. Thanks, Lindsay.
No problem. Thanks, Christina. So now we're going to open it up for questions and have a Q&A period. And we invite you to type your questions into the chat box, or you can also raise your hand using the Zoom feature. I believe it's under the reactions button. And we would be happy to answer questions at this time. Thank you. This could be questions about the stakeholder review stage that's coming up, or any of the content that was covered today, broadly about the purpose, scope, or some of the recommendation areas, or any of the information about indicator development that Christina shared. I see one question in the chat box, so thank you very much. The question says, broadly, how is this revision different than the 2014 version? So there was 2 recommendation areas that we were focused on or mentioned on a previous screen that are new for this second edition guideline, and more details will be provided about this when you sign up for stakeholder review. One of them is support from a system navigator, so focuses on providing navigation to support during care transitions to help people navigate the health and social care system. And there is another recommendation area that really focused on interprofessional collaboration between settings and sectors, and that's fairly new as well for the second edition guideline. Just looking at the chat box as well here. So we have a question from Marjorie. Can you share some of the challenges the review panel has encountered to date in the guideline development process? Great question. So thank you very much for that. I think that one of the challenges that has come up for the development of the guideline has been refining the purpose and scope. It is a very broad topic, care transition, that is relevant to so many different settings, and the needs of people during different types of transitions can look very different at different points in time. And so for the panel represents people from all different settings and sectors who are bringing their experience. So to really narrow down on the top 6 recommendation areas they felt were most important to be covered in the guideline, that was something that took quite a bit of discussion, but they did come to a consensus on that. So I'd say that was one of the things that came up at the initial meetings as well for the planning of this. All right, and see a question here about, will there be a pediatric inclusion at some point in the future? So thank you for this question as well. So transitions for pediatric patients or persons going from one setting to another setting, that is included. One area that is outside of scope for this guideline is transitions from pediatric to adult services, and that was not deemed to be within scope for this edition, and that was decided through consultation with the expert panel after looking at the type of transition and the complexities of that type of transition, as well as resources that are already out there. If you have further questions about that, you're most welcome to email us as well. We will post an email address on the next slide as well that you can contact for further information. I see a question here that says as well, now that so much of the work we are doing incorporates virtual care, hybrid care, does this new edition discuss or examine how organizations can mitigate the aspects of technology that keep our work siloed? So that's a great question as well. And I'd say this is something that perhaps we would welcome you to provide feedback on as well during the stakeholder review stage. If there are areas that you think, if you have feedback to provide about this, because this is very relevant to our day and age, we would welcome you to provide feedback on this in the guideline. We did not have any specific recommendation questions about, say, providing virtual care or hybrid care in this guideline, but there may be some opportunities to weave in content about that after we consult the expert panel as well. Nafson and Verity, if there are opportunities or if there are things you'd like to jump in as well, please feel free to do so. Okay, so there's a question here that says, I believe you had stated micro transitions, i.e. shift reports, was outside of scope, and will this be included in the future? So thank you for this question as well. So this decision was made in consultation with the expert panel at the beginning of the guideline development process as well, based largely on the fact that the guideline would focus on more larger scale transitions between settings and sectors, as opposed to those micro level transitions. So the guideline will go through a 5-year revision cycle as well, and perhaps in the future this is something that would maybe come up as well, but at this time it is was deemed to be outside of scope by the panel. Thank you for these questions. Christina, if there are also any questions that you have for the participants of today's meeting that would be helpful to ask, feel free to jump into. We have a little bit more time for question and answer, so happy to keep this open a little bit more and see if more questions come up from anyone. If there are any questions as well that I didn't fully answer, they'd like more information on, for any of those people who previously just asked questions and I provided a response to, please feel free to speak up if you'd like further clarification. Okay, so we have a question from Marjorie as well. Do we expect the implementation of the guideline will be undertaken within organization as well as within OHTs? So this is something, it's a great question as well. Susan, I don't know if you're on the line as well, if you wanted to speak at all about the involvement of implementation.
Sure. Yeah, thanks. Thanks, Marjorie, for the question. I think that a lot of the organizations that are part of, like, we have many BPSOs that are BPSO directs as well as being BPSO OHTs, and BPSO directs, they periodically, like approximately every 2 years, need to select the next guidelines that they focus on. And I'm anticipating and have so far seen that many of those organizations that are also directs are choosing care transitions at the individual organizational level. And that will pair nicely with their work that they're doing with BPSO OHT. I think, care transitions is a really important topic for so many organizations, for accreditation and for OHTs across Ontario that aren't even part of the BPSO OHT program. So I think it is going to be a guideline that will be very popular, and really it is, we consider it foundational, and it is going to be mandatory for all BPSOs anyway. So I think that there will be huge uptake for this guideline across multiple different sectors, whether you're in an OHT or not.
Thank you, Susan. Okay, we have a question here from Lilybeth. Will this guideline include content around care transitions in senior care, i.e. acute care to home, retirement home, etc.? Yes, this guideline would be focused on all sorts of transitions. So transitions from acute care to home, acute care to retirement home, home to long-term care. Any of those transitions would be included as within scope for this guideline. Okay, so we have a question from Aliyah as well. At this phase, I'm wondering what recommendations within the guideline will be mandatory for BPSO OHTs to implement. This may be a question that can't be answered just yet as the guideline is being finalized. And also, will there be stakeholder engagement specifically from BPSO OHTs on which recommendations for BPSO OHTs will be mandatory? So maybe I'll briefly speak to this, and then Susan, if there's anything you would like to add as well, please feel free to jump into. But in terms of the stakeholder review stage, we are planning for a bit of a different type of stakeholder review with OHTs for this guideline as well. So there will be opportunities for OHTs to provide feedback on the guideline as a group, whether that is verbally or through written feedback as well. And maybe this is something that we can consider at that stage for stakeholder review to some feedback on this. But Susan, is there anything else you'd like to add for this question here?
Thanks. You answered it really well. And I think that in that stakeholder review process with OHTs, that's an opportunity for us to kind of check back on those mandatory recommendations, but those have not been established yet.
Thank you. Sometimes it takes time for questions to percolate as well, so I just want to give opportunity for that too. They're all very good questions as well, so thank you for bringing these up. Okay, so maybe I'm going to move on and I'll just share a little bit about what we can do next if you do have further questions, and then we do have some more time for today's meeting as well, so we'll keep it open for further questions that come up. But if there are questions that come up sort of following the meeting today that you'd like to contact us about, we invite you to reach out and email us. You can reach out to Verity Scott, who is the project coordinator for this guideline. And as we mentioned before, following today's meeting, the key components and content that was covered during the presentation will be available in a handout that we'll be sharing with you. So that can be distributed to others who may not have had a chance to attend the meeting today as well. And also please stay tuned for further information about that second presentation that will be held on the Care Transitions Guideline and how it can support integrated care and Ontario health teams as well. So just taking a look and seeing if there are any other questions. All right, we are very grateful for many people attending today. We have a question here from Marjorie. For our planning, when do you anticipate BPSO starting to implement the Care Transitions Guideline? So again, Susan, if you're there, maybe you could speak to this too, but in terms of publication, we are looking at early 2023 for publication. So after that would be, after publication is I think when we'd be planning, BPSOs could start planning for implementation. But Susan, is there anything else you would like to add about that?
Yeah, well, I think what we've considered is that if BPSO OHTs are participating in the stakeholder review process, that they get a sneak peek of what the guideline is looking like and the areas of recommendation. I mean, even today you're talking about the general topic areas, but then, you know, the actual stakeholder review, they'll get a much clearer idea of what the guideline will look like. And the final publication will look quite similar based on our past experience to what the stakeholder review version. So I think you could begin some preliminary planning and, you know, considerations for the planning and then getting deeper into the work once it's published.
Thanks, Susan.
Lindsay, if I can add as well, I think we're also hoping to have a lot of basically to have the evaluation monitoring chart be essentially identical to what's being published as a data dictionary. So that if you won't necessarily have to wait for the data dictionary to be published to start beginning your planning once the Care Transitions BPG is published.
Thanks, Christina. Any last questions that you might have for us at this time? Maybe at this time then, I'll just say a very big thank you as well for attending the meeting today. We are really looking forward to receiving feedback on the guideline from stakeholder reviewers. And we are looking forward to that time and actively planning for that. If you do have any further questions that come up, please do not hesitate to reach out to us. And oh, I just see one more question popping up in the chat box here. This was recorded and will be shared to watch at another time. So I believe the recording can be made available. Verity, is there anything else you would like to say to that?
Nope. We'll go ahead and email all participants who registered for the session and make the recording available online as well. So in follow-up to this session, we'll send it to everybody who was here or anybody who expressed interest. And you can feel free to pass it around if you had colleagues who weren't able to join who might be interested in the information.
Great, thanks, Verity. Yep, and Nafsan has put in the chat box as well the link that you can use to sign up to become a stakeholder reviewer too. Thanks, Nafsan. All right, so I will say a big thank you again, and we wish you a great rest of your day today. Don't hesitate to reach out if you have further questions, and take care. Thank you.